Obstructive sleep apnea is probably an under-recognized and underdiagnosed condition, but is very common. And essentially, when we go to sleep, the muscles in our neck relax, and that causes some narrowing of the airway and occasional closure of the airway. It's normal to do this a few times during the night. However, if this happens to an excessive degree, when these episodes of airway closure happen, this means air cannot pass and your oxygen levels drop throughout the night. When you have lots of episodes of your oxygen levels dropping through the night, it disrupts your sleep quality, and it can cause symptoms like fatigue or sleepiness during the day, headaches, needing to get up frequently to go to the toilet at night. It can also make you feel breathless at times. It can change your mood and cause brain fog. And because you are having these multiple episodes of the oxygen levels dropping, it can also impact other symptoms and other parts of the body. So, for example, we know that having low oxygen levels can put strain on the heart, and that may lead to other problems. In a similar way, when the heart struggles and the vessels of the heart and other vessels leading to other parts of the brain, the body struggle, that means that you can have an effect on your brain and other organs like the kidneys. So having obstructive sleep apnea is not just about the condition itself, it's also about the far-reaching effects that obstructive sleep apnea has. The commonest symptoms of sleep apnea are patients who have excessive fatigue during the day. Some patients often complain of also falling asleep quite easily during the day, and that's called daytime somnolence or excessive daytime somnolence. But you can have other symptoms. Snoring is another common condition, although while snoring is a common condition, just because you snore, that doesn't mean you have obstructive sleep apnea. You can also wake up with headaches in the morning, need to go to the toilet frequently at night. It can affect your mood and your memory, and some patients really struggle with brain fog. The way we diagnose obstructive sleep apnea is by doing a sleep study. And there are a multitude of sleep studies available, and the type of sleep study an individual has will depend on their symptoms and the individual patient. The more complex sleep studies involve wearing nasal prongs and bands around your chest and tummy, as well as a finger probe to measure your oxygen levels. And we might do that for patients who are quite complex. There are simpler and more novel technologies that use either just a finger probe and a smartwatch, or sometimes just a button or a device that's worn on the neck. With all of these studies, it collects a lot of data, including the oxygen levels, the flow of air in and out of the lungs, and that data is then analysed by somebody to look at whether somebody has obstructive sleep apnea or not. The treatment options for obstructive sleep apnea to some degree depend on how severe the obstructive sleep apnea is. So for mild obstructive sleep apnea, patients may wish to consider some lifestyle modifications. So for example, if you're carrying a bit of extra weight, then some weight loss and exercise may well help that. If you have more severe obstructive sleep apnea, the gold standard treatment is something called CPAP therapy, or continuous positive airway pressure therapy. And that treatment is a mask that you wear at night whilst you're asleep, and the mask delivers some gentle pressure to help keep the airway open and help stop these episodes of airway closure. In some individuals, you could consider something called a mandibular advancement device, which is a specialist mouthguard that is worn that helps bring the jaw forward and again open up the airway to stop these episodes of airway closure. So there are lots of health risks that are associated with untreated obstructive sleep apnea. We know that if you have sleep apnea that is not treated, you are at increased risk of having high blood pressure or high blood pressure that is difficult to treat. You're also at an increased risk of having heart attacks and strokes. Obstructive sleep apnea can also affect your kidneys and liver, and also can contribute to diabetes. We also know that having untreated or undiagnosed obstructive sleep apnea can actually reduce your life expectancy. So it's really important to identify and treat it.